All right. I am really excited today to have Lindsay Constantino with us, and we're going to talk a little bit about our frustration with the healthcare industry. And Lindsay, before we dive into this topic that's all over the headlines, tell us a little bit about your background and so that we understand your perspective on this problem.
Yeah, well, this is everybody's favorite topic to talk about these days. So thank you for having me. My name is Lindsay Constantino. I actually grew up in independent pharmacy. So my background is completely in pharmacy. Interestingly enough, I am not a pharmacist, but I do own a pharmacy. And our pharmacy actually supports the chronically ill and aging in place in the community. So we're solely focused on that extremely high risk, high cost patient population who does not want to go into facilities, is trying to reduce their hospitalization rates. Patients who are truly burdened by the healthcare system are the ones who are passing through our doors. So I have a lot to discuss about this topic.
All right. Well, I'll let you kind of take the lead here. Tell us, what's on your mind related to this problem of the healthcare industry, whether it be pharmacy or the systems or Medicare, Medicaid. I'll let you kind of just kick this off on what you see are some of the big challenges.
Well, can we say all of the above? I truly it when you look at the healthcare system as a whole, you have kind of three different segments. You have your Medicaid population, you have your commercial insurance population, and then you have your Medicare population. And even when you get to Medicare, you have that dual Medicare or Medicaid mixed population. So let's call it four. Um, each little column has its own unique challenges, but I think the one that we are most concerned with these days tend to be the commercial and the Medicaid, Medicare population. Because when you look at straight Medicare, there's issues there, but a lot of them are pretty much sorted out. And when you look at straight Medicaid, there's issues there, but a lot of them are sorted out. It's that dual population and the commercial population that tends to have the issues.
All
So
right.
go
Yeah,
ahead.
well, out of curiosity, like I want to sort of put this from the perspective of I'm walking into the door of your pharmacy and sort of like your perspective is and what you see. So like when one what are some of the challenges that you see the consumers facing when they come in with a prescription and hand it to your pharmacist and from each of those verticals?
Yeah, the 100% the biggest thing is cost. So the fact of the matter is patients just don't really want to pay for medications and you can't blame them, right? Who actually wants to take medicine and then here you have this high cost prescription that you have to pay for. It's frustrating. It gets really interesting because when you look at particularly your aging and your chronically ill population, there's different access points to them be able to get medications affordably. But the majority of the medications that actually best support their chronic conditions are extremely costly and they're sometimes difficult to access because there's things like step therapies that insurance companies put in place that require them to try other treatments and quote unquote fail at those treatments before they can actually take the most effective medication. So it gets frustrating to us as pharmacy providers because we look at this and we go, we know that this is the best med for the patient. Why can't the patient just start this right away? Aren't we going to avoid a hospitalization and so on and so forth if we can just start this? And it gets more frustrating for the patient because they have more to deal with their condition. I mean, who wants to try a medicine and then have to fail it, or who wants to have to go through all of these hoops on prior authorization just to be able to take a med that can better their health? Nobody
Now,
really wants to deal.
yeah, let me I'm this is fascinating and I didn't mean to cut you off, but the number one, I didn't know that there was a term for the step treatment. I'm glad to discover that. I remember dealing with that with our children
Hmm.
with a medication. And then one of our friends said, "Oh man, you're going to go through a month of pain. This med, that med didn't work for us. See if you can jump the line and just get straight to the med." Do you have any guidance for consumers? Like, is that a possibility? Is there a way that we can advocate for ourselves and uh, in this system?
So the insurance companies have a process called a prior authorization where at times you can avoid that step therapy or that first therapy and the doctor can submit prior authorizations. That's not guaranteed. So what we typically suggest to patients is to advocate, advocate, advocate. And that's a whole issue within itself because to advocate for yourself to the payers, it's really hard to do. It's a lot of time on the phone. It's a lot of time on just sending to big email boxes and hoping that you get a response. So if you can get a lot of documentation and kind of back up the reason why you should start this medication ASAP, it can be very, very helpful to ensuring that the prior authorization process goes through the first time and you don't have to go through those failures of treatments.
So maybe now one of the groups of professions that is in our positive aging community are patient advocates, and
Mhm.
oftentimes they're but very few people have a patient advocate that they can bounce these ideas off of. But it could be that you're an adult child and your mom is has a doctor's appointment. I guess the first question to ask is just number one for all of us to be aware of this step. What did you call it again?
We call it step therapy.
Step therapy. And saying to your doctor when they write you that prescription, let me ask you something. Is this part of a step therapy process? Or do you is this sort of the first med? And if it doesn't work, then we're going like what question could I ask
Well,
to advocate?
here's the thing that's a little scary. A lot of times the doctors don't realize it. So, the doctors give you that prescription. They're assuming that you're heading out to your pharmacy and you can get it filled. They don't realize that when they come to the office the day after or the following day that they're going to have an inbox flooded with prior authorization requests. So, the
Ah. So
yeah,
the doctor might be writing you a med, and this again, now we're talking about how screwed up the system is. The
exactly.
doctor's writing you the med that he thinks is going to be best for you. He doesn't have the time or capacity to go into your insurance system to see that you've got to do a step therapy to get to that med. You go to the pharmacist, they say, "Oh, uh, here's the bill for your med. You expected to pay either nothing or a copay, but it's going to be $1,000. Now you can't get anything. You got to go
Well,
back to your doctor."
so that typically is what happens, right? You have the doctor writes the prescription, the patient goes to the pharmacy, and the pharmacy says, you have two options. We either have to get a prior authorization for this, which is probably going to take, anywhere from 3 to 10 days to start treatment on this medication and not guaranteed to go through. Or you can pay quote unquote out of pocket for this medication, which means that since your insurance technically isn't covering it, you can pay for the medication out of pocket. And I mean, some of those therapies are thousands of dollars.
Mhm.
So it's not realistic to get a patient to actually pay for those prescriptions. So they often have to go through the prior authorization process. When you look at, we talk about advocacy, when you look at like case managers and patient advocates that are available, it's really interesting because when you have a child, like you were talking about, it's typically the parents who are managing everything. When you talk about the aging population, it's typically the oldest daughter who's dealing with everything. So, what a lot of those caregivers don't realize is that typically, if you're using a large hospital systems usually have advocates or case managers that are embedded that can actually help you. So, always, 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 when you get a prescription from the doctor or you're going through any type of treatment, whether it be like a in-hospital medical treatment, outpatient, or just medication therapy, ask your doctor if there's a patient advocate or a hospital representative. And then also, what a lot of people don't realize is that a lot of insurance companies actually have representatives who are embedded in the hospitals to help patients. So there are insurance case managers, insurance social workers who are all around those hospital systems working for the insurance companies, but there to be able to support patients. And they're not utilized like they should be. So
Okay.
absolutely ask for those resources.
Now, should I be concerned about the objectivity of a case manager that's working for the insurance company, I get how if I'm writing a check to my own personal patient advocate, they're working for me. But if they're with the hospital or the insurance company,
So either way, you're going to have to work within the walls of the insurance company, right? So I think that sometimes the access to the insurance representative can be beneficial. You have that case manager who may be able to get a hold of different individuals, but your patient advocates and those groups that you can pay out of pocket for, they do just as great of a job to be able to access those individuals. What we often see with the latter group is that they know who the case managers and who those social workers are, and so they can get right to them instead of patients being put in a queue in hopes to reach make contact with them.
yeah, and I mean, again, I think it's no secret that there's frustration here. The fact, like, I was not aware that insurance companies had case managers. I
Yeah.
can understand what, like, I think everybody is probably like, oh yeah, because of X, Y, and Z. Well, no, it's in their best interest that cases are solved in a timely manner. So if you've got a case manager that says this medication is not going to be improved under your insurance, let's talk about alternatives. Now, the first shot is hopefully going to be the best shot.
Oh,
Um,
100%. And it gets interesting when you start looking at the actual business of insurance because they have a very, very short revenue cycle on a patient to make a profit. They can't guarantee that a patient year over year is going to be with them. So a lot of times when you look at where insurance companies or why insurance companies do what they do, a lot of it is because they just don't have a lot of time with that patient, especially because these patients are so costly and there's so much expense that goes behind actually insuring a patient. These processes are put in place to make the insurance companies be able to reach the revenue cycles that they want to reach with those patients within that year time frame. So it's, I mean, not that I'm advocating that it's good for them to have that, but I mean, when you start looking at the logistics of the business and why this happens, that's often why the insurance companies are so strict with this. And it's frustrating, but that just is the case.
Yeah, and I guess since you opened the door, let's go down the rabbit hole of profitability in insurance. And there's nonprofit insurance companies, there's for-profit insurance companies. That I guess in a perfect world, we all just want to think that there's no sort of shareholder or money motivation here, that that it's basically taking care of ourselves and our loved ones. But the reality is that whether it's for profit or nonprofit, the revenue has to be more than the expenses for these organizations to be sustainable.
100%. I mean, when you look at it, health insurance is a business. And whether you are a publicly traded company, for profit, nonprofit, whatever it is, businesses have goals. And sometimes those goals are to the detriment of the health of the patients that are being insured. So it gets really interesting when you start getting into those topics because I think that in a way, insurance companies and being public insurance and being for profit leads to a lot of innovation. But again, I think the biggest barrier to why there are so many so many hurdles that patients have to go through every year to get tests covered and treated and so on is because of this very, very short revenue cycle. I think if there was a way that patients could be managed over the course of 3 years or 5 years, I think that you would have a lot more success in not needing those hurdles for patients because the insurance company could look at that from a business perspective and say, okay, we have a lot longer time to meet our business goals on this patient.
Mhm.
So it's difficult because you don't really want to be talking about patients like they're dollar signs, but insurance is a business and that's what it comes down to.
Okay, so I know we've talked a little bit about the private insurance companies. I had no idea about the patient advocates that they have. Always asking questions, folks, advocate, what have you. Let's talk a little bit about Medicare and Medicaid, our government insurance company. And again, I'm walking into your pharmacy and I've got these prescriptions and I'm on Medicare or Medicaid. And folks, Medicaid is designed for people that are impoverished. That's our program for that. And Medicare is a government healthcare system for people who are disabled or over a certain age. Um, Tell us your some perspective there and then maybe some solutions.
So, Medicaid is for those who are below a certain income level. And typically, what we see in Medicaid is that the majority of prescriptions, from the pharmacy standpoint, are covered. There's usually no or very low copays. You do still have to go through some hoops of step therapies and things like that for very, very expensive medications, as expected. But in general, your Medicaid population has a copay structure that's pretty affordable for what their income is. When you start getting into Medicare, things get a bit more complicated. So a lot of what is available on Medicare is based on the different plans that you can select. So what we often see is that patients will choose plans that have lower premiums, so they're paying a lower guaranteed monthly payment. But what they typically don't understand is that those lower premiums mean increased costs and copays. So patients will look and they go, "Oh, I'm getting a great Medicare plan. I'm paying $0 out of pocket every month." But they get to the pharmacy and every prescription that they take, and now granted, our patient population takes an average of 9 prescriptions per patient. Every prescription could be $10. And they look at that and they go, "I can't afford $90 a month on my prescriptions." So you at that point have to have a conversation with the patient that says, well, when you're looking at your Medicare plans, it may be better for you to pay $40 out of pocket every month and only have a $3 copay on your prescriptions rather than pay zero and have a $10 copay. And now I do believe that the difference in plans can be beneficial. I think that there are a lot of opportunities for patients to be able to get coverage in areas that mean most to them. Or if a patient isn't chronically ill, they have different opportunities to be able to, take different maybe preventative care measures on certain plans. But in general, we see that there's a lot of confusion, particularly with your older aging Americans, say your let's call them 80-year-old plus, simply because it's confusing. It's a bit overwhelming when you're going into that portal every month and selecting your health plan. So there's benefits to having the availability to choose plans, but also it can be really confusing and detrimental to the patient if they don't choose the correct one.
Yeah, and I think there's the prescriptions that you're taking at the time of plan enrollment, but then if you have an accident, injury, a new diagnosis, and it's the middle of your plan, and it's sort of like, well, I never knew I was going to take this, and I signed up for this Medicare Advantage plan. So I think it's
We see that all the time.
just folks, it sounds like a solution here is just be really careful when you're signing up and really try to look at those prescriptions. I've never heard it framed that way, that the premiums might seem attractive, but based on your prescription mix at this point in time, very important. And then also reflecting on each year when open enrollment occurs, did you have a healthcare change? Are you taking certain prescriptions now that you weren't when you signed up for the plan last year? Make sure to review that. Um,
Correct. And, I don't know if auto enrolled is the proper term to use, but a lot of times if patients don't like do the research and look for a new program, they just will continue on in their current Medicare program. And so what we'll see is someone did have a health change, but they didn't change their insurance. And so, even the premium or the copays of that insurance that they had last year will change, and they didn't realize it. So it's really, really important during open enrollment, and open enrollment just ended about 2 weeks ago. But it's extremely important during that season to really take a look at all of your meds, even take a look at your health tests and say, what could I possibly be concerned about next year? Don't be too proud that you think it's not going to happen to you, because we see it every single year that someone gets caught up in needing to pay a significant amount in medications because they didn't think that they would need to be on them.
Okay, now this is since you run a pharmacy, this is a question that I see that happens often is that, and it's happened to me, you go to the pharmacy, you've got your prescription, you really, your doctor's, you're in pain, you're sick, what have you, and it's denied. And it's sort of like there's a price tag there for that prescription. And you don't want to wait. You want to start doing this. So you're tempted to just hand the pharmacist your credit card. Are there choices out there that might enable me? Maybe I got to wait a day or two to get a lower cost. Or if I just truly can't afford it, we hear stories of people having to make a choice between eating and a medication.
Well, the fact of the matter is, if your pharmacist hands you over a prescription and they say, "Hey, it's denied, we can't do anything," or says, "Hey, this is going to be, $300, take it or leave it," then you need to change your pharmacy. You need a pharmacist who is actually advocating for you, and you need to be able to have a good conversation with that pharmacist and say, "What are my options?" Pharmacists know. Pharmacists are they can look up the formularies, and a lot of times, once you get to like mid-year, the individuals who are working behind the pharmacy counter, they can look at an insurance and they can go, "Oh, this is going to be denied. We're going to have to, we're going to have to call the doctor." And that pharmacy, before that prescription gets to you, they should be making that call to the doctor. They should be saying, "Hey, this isn't formulary for the patient, but these medications are formulary. Can we change these so the insurance will cover it?" And if your pharmacy isn't doing that, then you need to change pharmacies.
Great, great. Now, okay, we've talked about a lot of stuff, and I'm getting a headache because this is so frustrating and it's so heart-wrenching to think that families aren't getting the care that they need for themselves or their loved ones. We talked to you gave us some great tips there, but what are some of the other things that we can do as consumers or as professionals who are helping our consumers deal with this frustrating system?
I mean, honestly, as a patient, you need to just make sure that you're advocating for yourself or you have someone to advocate for you. And that means ask your doctor, who can help me with this, and get those resources. Don't just accept answers from your pharmacist. Ask your pharmacist, who can help? How can I get help? There's a lot of different, and calling the insurance companies can be frustrating, but there's a lot of different resources that the insurance companies offer that aren't leveraged enough by patients. So educate yourself on what your insurance does provide and utilize that. You're paying for it. You should use it. As a healthcare provider or a caregiver or a social worker, we really need to make sure that we are looking at our patients holistically and determining what not only their chronic illness needs are, but also what their social detriments to health may be. Social detriments to health is a big buzzword right now, but it's very important as providers that we're looking at our patients and saying, well, we keep telling our patients, you got to get to the doctors, you got to get to the doctors to get your refill or to get this test. But if a patient can't drive or a patient doesn't have a caregiver, then we need to figure out a way to get them that access. So we really need to look at our patients holistically and not only give them that treatment or that medication, but we need to be able to provide them the resources to help manage their conditions and really manage their life a lot.
Yeah, so it might be like in that situation, it's as providers being aware of the volunteer ride programs that are in your community, the nonprofits that are supporting folks that are out there, and being able to share those resources. And I think I like what you said about if I go to a pharmacy and the answer is here, it's $300, sorry, I can't do anything. Again, I think part of advocating is understanding that we have choices out there, and it might take a while and it might not be that convenient, but finding a different pharmacy, finding a different physician when open enrollment comes, if you've exhausted everything at your insurance company, choosing a different provider. The thing that I like about our conversation today, like I've learned that the insurance companies have these advocates.
Mhm.
Like that's not something that people are we think about our premiums, we think about our copays, but we it's probably advertised somewhere in the mailings and emails that we get from our insurance companies, but we don't realize that they're out that they have resources out there that we can utilize.
Oh, absolutely. If you are utilizing a large health system or a big hospital system, 100% when you go to the doctors, you ask who is the insurance representative on site, who's the case manager for X insurance plan, who's the social worker, and get in front of them because they're there.
Yeah. Okay. Well, this has been really informative, and I don't want to put you on the spot, but if you had a magic wand, um, what would you like to see change? Like, and this is just dreaming a little bit, but in Lindsay's, world, it's kind of like, gosh, if we just had X, Y, and Z, it would make a huge difference in terms of care delivery.
So, when it comes to what a patient can do independently in their community to support their chronic disease, taking their medication properly is the number one impact that they can make. They can prevent hospitalizations. They can reduce the number of medications they're on. They can increase their health outcomes. They can feel better. And the biggest barrier to cost that we see every day in the pharmacy is the actual copay, the cost of the medications. In my dream world, my dream insurance structure for patients would be a little bit of a higher premium across the board and zero copays. I think that if we were able to get patients zero copays on their medication, they would actually take the medication because they wouldn't have that barrier. So that would be my dream scenario.
I think that sounds great. And I think that, we've all taken medications with zero copays. Like, I
Yeah.
mean, so it just pulled the curtains behind from a pharmacy owner's perspective and tell us a little bit why I can have some medications with zero copay and others that aren't covered by my insurance company or are have a higher copay.
It's totally dependent on the formulary for the insurance company. So a lot of times or probably at open enrollment time, the formularies are released so that you know what medications are covered and are not covered. Typically, all medications are covered in some form, but it's just how much of that medication is actually covered. So within those formularies, there are tiers of medication, and tier one may be these 200 medications have zero copays. And tier two is these 200 medications have a $2 copay or a $5 copay. And then it just increasingly gets more expensive. And you can also have, instead of copays, you can have co-insurance, which is the insurance pays for a percentage and you pay for the other percentage of the medication. So it really just depends on how the tiers of the formularies that the insurance companies released are valuing that specific medication. And it's also broken down into generic and brand name medications. So your generic medications are typically ones that are covered at zero or very low cost. And your brand name medications are the medications that are typically having a large copay. What we usually see, like at least a $7 copay, and then all the way up to hundreds of dollars. When you get into Medicare, it gets even more complicated because there's different types of deductibles you may need to hit, or there's different types of times within your Medicare coverage on a yearly basis where you may pay more, you may pay less, depending on how much money you've spent. So it gets very complicated. But the basic answer is the formularies and the tiers in which your medication fall into within those
Okay,
formularies.
yeah, and I imagine those tiers are basically how many people take these medications, how much the market, again, like you said, this is all coming down to money
Yeah.
and profit. Now, as a pharmacy owner, we hear all these stories about you can go to Mexico or Canada and walk into a pharmacy and pay $5 for a medication. as a pharmacy owner, I guess you have studied this a little bit. Like, why are medications so expensive in the States compared to other countries?
It's a bit perplexing. I remember being very young. I had just started college and I had gone abroad, and I walked into the airport, and in the airport was a brand name pain cream that cost $700, $800 maybe, when my pharmacy purchased it. And I looked at it and I looked at the box and it was like 25 euro.
Hmm.
And I was so perplexed. I remember taking pictures of it and like calling my dad, who's a pharmacist, and being like, "Can you believe this? What's going on?" And I think that there are such different systems for healthcare delivery in Europe and Canada and Mexico, and a lot of it is government controlled. And when you have that, you have different pricing availabilities. When you look at it, drug manufacturers, insurance companies, the majority of their profit is made in America, and it's not only because we're the most sick or the most chronically ill, but it's because the system that we have enables them to be the most profitable here. So I'm not necessarily advocating that that's a good thing, but it just is.
That helps. It helps me understand this a little bit more, and I like your idea. Is that, gosh, in if we could wave a magic wand and there's either no or a consistent low copay,
Mhm.
and we can somehow figure out how that can, through premium adjustments and through whatever, that the drug companies and the insurance companies can sustain themselves and not lose money.
Right.
The That might be a better world. Well, holy cow, I am definitely going to have you back on to one of our discussions with a live audience. I can just imagine all the questions that our positive aging community members might have. But this has been a fascinating discussion. I really applaud you for your transparency. You're embedded here in the healthcare industry, and you're willing to talk about, the challenges and dream about how it could be better.
Well, thank you for having me. I look forward to coming back. And the more that we are educated about this, and the more we hear from people like me who know what goes on behind the scenes to an extent, I think that the more it doesn't lessen our frustration, but I think that we can look at it more from a holistic view and go, okay, this is why this is happening. And I think that knowledge can make everybody feel better.
I love it. All right. Thanks so much.
Thank you.